Hi everyone, Dr. Jenny Brown at NRM in Vermont. Today we're going to talk about what to expect at your first visit. So your first visit is typically done actually via telemedicine for your convenience and to save you the time of driving. You can even do it right outside your place of work or in a quiet space. This typically takes 45 minutes to an hour, and on that visit, number one, I want to hear what are your goals, what are your hopes and dreams for your family, what is your ideal family size, and your timeline. Number two, I want to learn all about your medical history, and if you have a partner, their medical history. So any past medical diagnoses, medications that you're taking, surgeries, allergies to medicines, any past fertility treatments. For female patients, I would like to know about their menstrual cycle. For male patients, any difficulty with ejaculation, erection. I would like to know all your history, anything you think I need to know to help take care of you better. Then we'll plan your diagnostic workup. Right on that visit, we'll talk about your next steps. It typically takes 1 month to get through a diagnostic workup, or one cycle. If you are a female that does not have menstrual cycles, we can time that workup with labs to see when the best time would be to do the evaluation. So the workup involves an ultrasound. The ultrasound is for the female partner to look at the pelvic anatomy, so the uterus, the tubes, making sure that everything is normal in appearance and can allow the egg and sperm to meet. It's also to look at the ovaries and to get an idea of the ovarian reserve. So that ultrasound will be performed typically between day 6 and 12 of your cycle. So the way we plan that for our individuals with regular cycles is you contact us on cycle day 1 and we set that up. If you don't have regular cycles, we'll walk through the plan with you. Step 2, on that same day of the ultrasound, we'll do blood work. We're going to do blood work for both partners or any individual undergoing treatment for infectious disease testing, just to make sure we're at a safe starting point, and then also genetic carrier screening. We want to make sure that the egg and the sperm source don't match up with carrying the same recessive diseases, because that can increase your risk for having a child affected with that recessive disease, for example, cystic fibrosis. So these are recessive, meaning that you don't necessarily have a family history or know that you carry these diseases. They're silently carried until you match up with a partner who carries the same disease. So we'll check that blood work. We'll also check a semen analysis for any male partner, and then we'll take a look for the female partner at other labs, some of which are going to be individualized based on your history. And for all, typically we're going to be checking your AMH, which is your fertility hormone, and also your TSH, which is your thyroid hormone. So with that, we've now had the anatomical test of the ultrasound, the egg evaluation with the AMH hormone and also that count on ultrasound, the sperm evaluation with the semen analysis to look at counts, motility, and morphology of the sperm. And we'll come back with all that data and regroup again on telemedicine if that's convenient for you, or in person if you prefer, and we'll make a plan. So typically you have that new patient consult bookending one end of the month, and then the regroup appointment with all the results bookending the other end of the month, and the workup in between. And at that regroup, we can make a plan for your next steps of treatment, give you all your options, and you can decide what's best for you. So hopefully that helps take any fear away from the new patient appointment. It's really just a conversation, and most of my patients leave feeling so much better that they understand what we can do, they understand what we can test for, and they are empowered with knowledge so that they can take their next steps. All right, look forward to meeting you. Thanks.